Hello everyone, I am Dr. Mohammad Aftab Alam Ansari, Senior Consultant, Department of Radiation Oncology at HCG Ansari Cancer Hospital, Ranchi. So मैं आज बताने जा रहा हूँ आप लोगों को what is radiation therapy. So this is radiation therapy is one of the commonest form of treatment for cancers. What does it do basically radiation? It kills the tumor cells and shrinks the tumor or completely मेक इट गो अवे. यूजुअली जो ये रेडिएशन थेरेपी है ये कई बार कुछ पेशेंट्स में सिर्फ रेडिएशन के फॉर्म में हम लोग ट्रीटमेंट देते हैं और कई बार दूसरे पेशेंट्स में हम लोग इसको कंबाइन करते हैं सर्जरी के साथ, कीमोथेरेपी के साथ, इम्यूनोथेरेपी के साथ, टारगेटेड थेरेपी के साथ टू गेट द बेस्ट रिजल्ट्स इन कैंसर. Once disease has spread to different part of the body, in that case what we do, we give radiotherapy. Sometimes it is called palliative radiotherapy. So in that scenario, what it does, it shrinks the tumor and that makes patient feel better. Sometimes pains goes away. So this is how it works. So coming to what are the types of radiation? So basically radiation can be given in different forms. Mainly there are two forms, external and internal. External means when the machine is situated or located in your surrounding or outside, like CT scan machine, and machine rotates around you and gives you radiation from outside to a particular point or a tumor inside a patient body, and this is called external beam radiation. And internal radiation or brachytherapy, this is the other type of radiation therapy where radioisotope is directly placed inside tumor or near the tumor. So this is how brachytherapy works. So this has got different machine, smaller machine. So once you need radiation as a patient, then you go to radiation oncologist, and radiation oncologist will tell you basically which form of radiation is best for you, whether it's external beam radiation or internal radiation, or sometimes it's a combination of both which is required to achieve the cure. Commonest example is basically carcinoma breast, where we use external beam and brachytherapy also. So this is the form of radiotherapy. So once it is decided that external beam is the commonest form of radiation therapy, once external beam radiotherapy is decided by your radiation oncologist, then what happens, you are being immobilized in certain position with or without plastic or thermoplastic mask to make it reproducible, your position for everyday treatment. So उसमें आपको एक particular position में लिटाते हैं, mask देते हैं, and again some mark are made on the mask or sometime on your skin, and then the particular area which we are going to treat, like head neck, in that case in that area we take a scan of those area. So that is called basically CT simulation. Once that is done, we transport this CT scan data to our treatment planning system. This is very sophisticated software where a treatment plan is being made by a medical physicist as per requirement of that particular tumor or that patient, how much dose should go to tumor and how much dose should not go to the surrounding nearby normal tissue. Once that plan is made and radiation oncologist approved it, in that case then patient is being asked to come for treatment. That usually takes few days to get these things ready, and then patient comes, and every day in that particular position patient is given radiation therapy. So one of the commonest question in our OPD or in clinic, patient asks before starting treatment, sir ये क्या painful होगा, will it hurt me? So answer is no, it's painless, it does not hurt और इसको देखा भी नहीं जा सकता. But during the course of radiation, usually there are typically 5 fraction or 5 days of radiation in 1 week we give. So after second or third week, patient start to have or experience its effect, and these effects are, or side effect you can say, these are temporary. If there are big lymph nodes are there in neck region, once 10-15 fraction of radiation is done, that tumor shrink. but nearby structure will also have some radiation, and from that one may have some side effects. The common side effects are basically, one is very common in patient, that is fatigue. So many of the patients experience fatigue, and this fatigue is different from common fatigue, which is usually goes away with sleep or cup of coffee. It doesn't go away. So this is remains during the entire course of the treatment, but this is temporary and it goes away gradually once treatment finishes. So if you have like fatigue or it's a symptom, then you should be discussing with your radiation oncology team to make it easy for you. Coming to another common side effect patient usually experience is the skin reaction. Skin reactions are usually in the form of dryness, sometimes itching is there, sometimes peeling of his skin. So what you have to do basically, and you have to remember that each patient have different kind of experience with same doses of radiation. Each patient is different. So in coming to skin reaction, once you have these kind of redness or itching or dryness, then what you need to do is basically use soft and loose clothes. Don't rub in that area of the radiation part of the skin. Then don't use too much soap or some creams. Don't expose that part of the skin directly to sun, and before applying any cream or something, you please discuss with your radiation oncologist. If you do this, then these side effects usually are limited, and these goes away gradually once you finish your radiation. Coming to other side effects, most of other side effects are basically dependent on location. So if you are having radiation in neck, then one may have pain in throat and sometimes difficulty in swallowing. So this is if one patient is having radiation in like abdomen or lower part of the abdomen, then in that case he or she may experience nausea, vomiting, or irritation of bladder, which may lead to frequent urination, sometimes diarrhea. So radiation effects also depend the site where radiation is being given. So you need not to be worried about these side effects, because most of these side effects are temporary and goes away gradually once you finish the radiation. Usually time taken for these reactions to go away is typically 3 to 12 weeks. And so if you experience any side effects, then you should not be getting down, and you should be discussing this with your radiation providing team, and they will help you out. And in case if you have anything, we are here, we are happy to help you. Thank you very much.